The emergence of COVID-19 in Wuhan, China, marked the beginning of a global health crisis. The virus's mysterious origins quickly captured worldwide attention, leading to unprecedented research efforts aimed at understanding its nature and preventing its spread. As countries imposed lockdowns, individuals found themselves navigating the new reality of quarantine. Personal stories from these lockdowns reveal a tapestry of resilience, fear, and adaptation, painting a vivid picture of a world paused yet pulsating with life. The mandate of face coverings introduced a significant shift in societal norms. This evolution of mask wearing, initially met with skepticism, gradually became a symbol of collective effort to combat the virus, showcasing humanity's ability to adapt for the greater good. The pandemic fast-tracked the transition to digital living, transforming how we work, learn, and connect. This digital shift, while challenging, ushered in a new era of convenience and innovation, redefining the boundaries between the physical and virtual worlds. Frontline healthcare workers emerged as the epitome of bravery and sacrifice. Their stories of relentless dedication amidst overwhelming adversity underscore the human spirit's capacity for compassion and resilience, serving as a beacon of hope during dark times. The race for a COVID-19 vaccine became a defining global endeavor, uniting scientists across borders in an unprecedented quest. This collective mission not only showcased the potential of international cooperation, but also reignited hope amidst the darkest days of the pandemic. As economies worldwide grappled with the pandemic's ramifications, the economic fallout became impossible to ignore. Industries crumbled, unemployment soared, and governments scrambled to inject life into faltering markets, highlighting the fragile interconnectedness of global economies. The abrupt shift to remote learning disrupted traditional education systems, revealing both opportunities and glaring inequities. Overnight, teachers and students had to adapt to new technologies, a change that may permanently alter the educational landscape. The pandemic cast a harsh light on the mental health crisis, as isolation, fear, and uncertainty took their toll. Anxiety and depression rates surged, underscoring the need for accessible mental health services and the importance of community and connection in times of crisis. COVID-19 laid bare the deep-seated inequalities within societies, from healthcare access to economic opportunities. The virus did not discriminate, but its impacts were disproportionately felt by the most vulnerable, igniting conversations around equity, justice, and the need for systemic change. Innovations born from the crisis have reshaped our world, with COVID-19 acting as a catalyst for technological advancements. Remote work software, healthcare apps, and contactless services flourished, demonstrating human ingenuity in adapting to unprecedented challenges and setting a new standard for convenience and safety. The return to normalcy remains an evolving concept, with societies worldwide grappling to define what the post-pandemic world looks like. Changes in work culture, public health awareness, and social interactions suggest a new normal that balances caution with the desire to reconnect. Pandemic politics have deeply influenced public trust and government policies, highlighting the crucial role of transparent communication and effective leadership during crises. The varied responses across countries have sparked debates on privacy, freedom, and the balance between individual rights and collective safety. The environmental impact of the pandemic has been a double-edged sword. While lockdowns led to a temporary reduction in pollution and a respite for wildlife, the surge in single-use plastics and decreased funding for conservation projects present new challenges. The art of isolation has inspired a surge in creative expression, with individuals turning to painting, writing, and music as outlets for coping with the uncertainty and solitude of lockdowns. This artistic renaissance has underscored the importance of art in healing and connection. In the shadow of the pandemic, conspiracy theories and misinformation flourished, challenging the global fight against COVID-19. From fabricated stories about the virus's origins to false claims about vaccines, the battle for truth became as crucial as the battle against the virus itself. The World Health Organization, WHO, faced both praise and criticism in its handling of the pandemic. As the international community looked to it for guidance, debates ensued over its response times, communication clarity, and overall effectiveness in managing the crisis. travel restrictions transformed the world into a series of isolated bubbles, upending the global mobility that was once taken for granted. Airlines grounded, borders closed, and the once thriving tourism industry faced an unprecedented crisis, highlighting our interconnectedness and vulnerability. Communities around the world showcased remarkable solidarity in the face of adversity. From balcony serenades to the support of local businesses and frontline workers, acts of kindness and unity provided a beacon of hope amidst the darkness of the pandemic. As the world begins to emerge from the shadows of COVID-19, the lessons learned are shaping the future of public health. With a renewed focus on preparedness, resilience, and equity, the global community is determined to fortify itself against future health crises. COVID-19 memorials have emerged worldwide, serving as poignant reminders of the lives lost during the pandemic. These memorials, varying from virtual platforms to physical monuments, offer communities a space to mourn, remember, and reflect on the collective grief experienced globally. As research on long COVID continues, survivors share their ongoing battles with its debilitating effects. These stories highlight the need for continued scientific study and support systems for those affected, emphasizing that for many, the journey with COVID-19 is far from over.